Hello, so today we are back to lymphomas and we are done with AML, CML, ALL, CLL, Hodgkin and non-Hodgkin lymphoma. Today we are going to do lymphoid neoplasm and mainly from the plasma cells, and these are multiple myeloma and Waldenstrom macroglobulinemia. Plus don't confuse myeloma with myeloid neoplasm. It is plasma cell neoplasm. So let's move with the topic. So multiple myeloma is plasma cell myeloma, and in this we have plasma cell and plasma cell secretes antibodies. So there are two variants of multiple myeloma: solitary plasmacytoma, which is single mass of the bone or soft tissue, and smoldering myeloma, which has no symptoms and IgM is high. One of the most common lymphoid malignancy is multiple myeloma. It involves cyclin D. Now talking about serum electrophoresis in multiple myeloma, there is M wave spike, whereas normally it is at low level. So here you can see the M protein spike. This is also called gamma globulin or immunoglobulin, which involves A, D, E, G and M antibodies. So there are two components of the immunoglobulins. There is a heavy chain and a light chain. And here you can see the multiple myeloma is of the IgG antibody, which is able to cross placenta. Next, the light chain consists of kappa and lambda chains, which are free light chains, small in size, so they can be excreted easily through kidney, and they are visible as Bence-Jones proteins by Bence-Jones proteins test. Although immunoglobulins antibodies are high, but they are non-functional, so immunity is overall low, and this leads to bacterial infection, and there can be kidney infections and kidney damage. Osteoclast activation leads to bone resorption, and there is lytic lesions in the bone, and calcium from bones leads to hypercalcemia in body. So hypercalcemia has effects of neurological disturbance in the patients and renal failure, as by calcium stone deposition and metastatic calcification of kidney. There is also anemia due to renal failure, as there is no erythropoiesis. Bence-Jones proteins are detected in urine. These are light chain proteins, pass through kidney to distal convoluted tubules and collecting ducts and form casts. Where the casts are formed, there is epithelial damage and macrophages attack this area and it's necrotic, and the cast deposits like this and blocks it, so there is renal function, and this is the main cause of the renal dysfunction. Total we have discussed the three causes. This is also called myeloma nephrosis, and death is mainly due to the renal cause. Next, these are the lytic lesions or punched out lesions produced by multiple myeloma, and don't confuse them with the hair and appearance of the thalassemia. You can Google it. If M protein is not present, do not completely exclude the diagnosis of multiple myeloma, as 1% of the multiple myeloma are non-excretory in nature. Mnemonic for multiple myeloma, which is MG crab. For M, we have M protein on serum electrophoresis, there is a M spike. For G, we have IgG antibodies. For C, we have hypercalcemia, which leads to R, renal failure, which leads to A, anemia. And there is also B for bony lytic lesions, and which causes hypercalcemia again, and Bence-Jones proteins for B in urine, which causes renal failure. So here we are done with multiple myeloma. Next we have is Waldenstrom macroglobulinemia, and there are high levels of IgM antibody, which is the largest antibody. So there is hyperviscosity syndrome in this. It causes lymphoplasmacytic lymphoma, and light chain complications which were due to kappa and lambda chain in multiple myeloma and Bence-Jones proteins usually do not occur here. So in lymphoplasmacytic lymphoma, there are inclusion bodies which are acid shift positive, and intranuclear inclusions are called Dutcher bodies, and Russell bodies are cytoplasmic inclusions. So the tip is D comes close to the start of alphabet, so Dutcher are close to the nucleus, which is the start of the cell. So now clinical symptoms are mainly weight loss, fatigue, hepatosplenomegaly and anemia. Autoimmune hemolysis, cold agglutinins, IgM antibodies bind and destroy RBC below 37 degrees. So at normal temperature, antibodies and RBC are moving separately, but when the temperature drops below 37 degree, RBC is destroyed by antibodies. So high IgM gives you hyperviscosity syndrome, and the main effects of hyperviscosity syndrome are visual impairment as small retinal vessels blood flow is impeded, neurological problems like headache, dizziness, deafness from blood flow decreased in small vessels, bleeding from the antibodies complexes with clotting factors and platelets, and cryoglobulinemia is the precipitate antibodies at low temperature causing Raynaud phenomena and purpura. So remember, visual impairment for eye, neurological problem for brain, bleeding, and cryoglobulinemia. So the tip we have is Walders is equal to elders. Elders watch BBCE. BBCE sounds like E. So B for brain, B for bleeding, C for cryoglobulinemia, E for eye. So in cryoglobulinemia, when the temperature falls below 37 degree, so the blood flow impedes in small vessels of hands and they turn white or blue due to lack of oxygen and blood flow, and they turn back red when the blood flow returns. Next, here you can see that the antibodies IgG, IgE, IgD and IgA are small, whereas IgM is a large antibody. So freely moving IgM antibodies raises the viscosity of blood and impede the blood flow in the small vessels. And the main treatment mainly include plasmapheresis, as the effect is mainly intravascular in this. If you have any question, you can let me know. Thank you.